It's the Brian Lehrer Show on WNYC. Good morning again, everyone. You know, while the Todd Blanche confirmation hearing for Attorney General got a lot of attention last week, the one for Centers for Disease Control Director got mostly ignored. But nominee Dr. Erica Schwartz surprised many senators, and not in a good way for someone whose selection was being viewed in some public health circles as surprisingly normal. We'll discuss the implications for her nomination and for your health now, where the doctor who writes about public health will also touch on why Defense Secretary, or War Secretary as he calls himself, Pete Hegseth, wants to mandate that troops over age 30 get tested for their testosterone levels. Here's Secretary Hegseth on that.
I'm authorizing a new screening program for testosterone deficiency for our service members, ensuring you have the right testosterone levels to operate at your absolute best.
Joining me now on both of these things is Dr. Jeremy Faust, emergency medicine physician, public health researcher, and author of the Substack newsletter, Inside Medicine. Dr. Faust, I've been reading you for a while. It's good to get to talk to you. Welcome to WNYC.
Thanks for having me.
And listeners, do you take testosterone supplements? It's a thing in the culture, not just coming out of Pete Hegseth's mouth for the military. Do you have questions about Hegseth's testosterone testing program for U.S. service members or the nomination of Dr. Erica Schwartz to lead the Centers for Disease Control and Prevention? Questions for Dr. Jeremy Faust, 212-433. WNYC, as always, call or text 212-433-9692. And Dr. Faust, will come back to testosterone, which I know you have opinions about, but let's start with Erica Schwartz, the nominee for Centers for Disease Control Director. Here's a short clip of Democratic Senator Maggie Hassan of New Hampshire and Schwartz at her confirmation hearing.
Will you follow the law or follow the president's instruction? Dr. Schwartz?
The president would never ask me to not follow the law, but I will always follow the law.
There are multiple examples of the president actively instructing people to break the law over and over again. So I hope you will update yourself on that.
The one thing that I can tell you is how I lead and how I live. And I have lived and I have led by my integrity. I have spent over 25 years in the uniformed services leading by integrity. That is what I can commit to you and to the committee.
So some clips of Senator Hassan and Dr. Schwartz as edited by The Root. Dr. Faust, your newsletter on the hearing was called She Blew It. And you write that you went from supporting her nomination to opposing it. Why did you first support this nomination?
I supported this nomination because it was a pleasant surprise. This was something that really cut across partisan divides. People looked at this nomination, Dr. Erica Schwartz, and on paper, she had the credentials. And importantly, she also had the receipts from having done the work well in service. And she had the backing of people who knew her who have respect, like Dr. Jerome Adams, who was the Surgeon General under President Trump in the first term. And Dr. Adams really did maintain his reputation despite sometimes being in difficult situations. So you put all of that together, and many of us felt that Dr. Schwartz's nomination was a very welcome development and part of a project that was going on at HHS and the White House this spring, where they wanted to get HHS out of the headlines and some negative press. There was literally a quote that was in the media from HHS spokespeople saying that they just want people who weren't crazy. And so Dr. Schwartz clearly met that threshold and then some. And then this hearing happened, and after a few minutes, it just began to unravel.
Was that exchange with Senator Hassan a good example?
It was, but it wasn't the only one. Again, she started with a very nice opening statement, and everything seemed like it was proceeding normally. Senator Bill Cassidy, who is the chair of the committee, who is also a physician, is really the key here. And he seemed very relaxed at first, and this was a little bit of not a coronation, but it wasn't anticipated to be heated. And you could see in particular Senator Cassidy, but also Senator Sanders and others losing it, just absolutely losing their minds because this person that they had read about and who they'd met behind closed doors did not show up. A different person showed up to that hearing.
And you wrote that anti-vaccine allies of RFK Jr. were at first vocally displeased with the choice of Dr. Schwartz. But here's a clip that you may have just been referring to of Dr. Schwartz being questioned by Senator Bernie Sanders. We'll get your reaction to this on the other side.
According to the American Medical Association, which represents over 270,000 doctors, quote, an abundance of evidence from decades of scientific studies shows no link between vaccines and autism.
Senator, we do not know what causes autism. 1 in 33 children have a diagnosis of autism spectrum disorder, and we owe it to the American people to figure out why.
So Dr. Schwartz and Senator Sanders, again, as edited for brevity by The Root. Did that exchange disturb you? I'll bet it did.
It sure did, because it didn't answer the question, and then you immediately wonder why. And the answer that many of us who look at these situations carefully could only conclude is that she is in some ways now compromised. I don't mean that in sort of a nefarious way, but I mean that she can't figure out who the stakeholder is. Is it the person in front of her, the senator? Is it the American people? Or is it the people who nominated her, President Trump and Secretary Robert F. Kennedy Jr.? And the way that she answered that question very clearly indicated that she had the third audience in mind, particularly Secretary Kennedy. And that is very, very disturbing, because the only confirmed CDC director during this Trump administration, Dr. Susan Monarez, was unceremoniously fired 29 days into her tenure as CDC director because she would not just go along with Secretary Kennedy's terrible views on vaccines.
Is it possible that the hearing shouldn't negate everything else on Dr. Schwartz's resume and in her record that led you and others to describe her as normal, obviously in contrast to some of the people who they described as crazy, you were saying, who may work for Health and Human Services now. Is it possible that the hearing shouldn't negate everything she's done before to flip people like you into the no column, that in a televised and live-streamed Senate hearing, and sure to be chopped up on social media into the most sensational things people could find, that she just didn't want to make a public spectacle of contradicting Trump or RFK because they might then pull her nomination?
It's a very practical question, and I think it speaks to the difference between being a pundit and an observer and somebody actually with the power. And I do respect that difference, and I think it's very easy for people like me to say what we would do. But what we really it's always the case, in the words of the late, great CDC Director Bill Foege, we only know what we hope we would do, not what we would do, because we're not there. But your point is really circling an important idea here, which is that the hearing did not go well, but what's the alternative? Because if Senator Cassidy in particular decides to vote no, and I suspect he's going to vote yes, but if he decides to vote no and this nomination does get defeated, what comes next? And what I think he's worried about is that who comes next will no longer be this campaign that HHS and the president have been on to lower the temperature and to kind of get a little bit more normalcy and expertise back into these agencies. And instead, there will be this pendulum swing. Okay, Senator Cassidy, you didn't take our very consensus pick. We'll show you, and they'll put someone out there who would make the anti-vaxxers very happy. So I think that's a real concern, especially since Senator Cassidy is no longer, he got primaried. So this is his last chance to see anyone get confirmed. That being said, these questions were softballs. These were not gotcha questions. You can answer those questions in a very specific way. For example, if someone says, if you're asked to do anything that's unscientific or that will break the law, you don't have to say, oh, I don't think I'd ever be asked that, because that's false. People have been asked to do that. You can just say, of course I wouldn't, but I don't think that would happen. But her answers were so bad that I think it made us question whether she would even have the spine to do the work. And so my feeling is vote no, because there's actually very minimal upside.
Before we go on to Pete Hegseth and testosterone, I see you did just do another newsletter about two of Trump and RFK's other leadership appointees doing a good thing with respect to vaccines. Want to touch on that briefly?
I do. And this was in particular a story that was published in Reuters last week. And in that story, it highlighted that the now former FDA Commissioner Marty Makary and the current NIH director and lead official at the CDC, Dr. Jay Bhattacharya, stood up to RFK in some kind of way against RFK's worst instincts in terms of vaccine policy. And in the case of Dr. McCary, he helped steer the idea of reducing the pediatric vaccine schedule away from a cliff, we read. And in the case of Dr. Bhattacharya, saying we did not need to spend $5 billion taxpayer dollars trying to look into autism and vaccines when we know that there's no connection. And the reason I thought this was so important is it can be vitriolic out there. We are all public health people, we're physicians, scientists, we care about this, but it can also get contentious and it can get polarizing and partisan. And what I wanted to say was that even people like Jay and Marty, who I often disagree with, when they do something right, we need to say yes and thank you, because it not only is that the right thing, but it actually incentivizes better behavior and more collaboration in the future.
And by the way, did you see the report that measles cases so far this year in the United States have already exceeded all of last year's?
Yes, I did. And we have not officially lost our elimination status for measles, but everyone knows that we have. And that's just a matter of getting the right people in the right room to make that determination. And it's an absolute reflection of anti-vaxxer policy and anti-vaxxer sentiment that has been fomenting for a long time. But I always try to look for a silver lining, and that is when there are outbreaks like this, we do know that is actually a time when people are reminded about the severity of these pediatric diseases, which we really got a handle on in the 20th century. And so vaccine interest does usually increase after some of these things. The problem is it's too late for some people who lost their lives or had brain damage or other terrible outcomes.
And with Dr. Jeremy Faust from his Substack newsletter, Inside Medicine, let's go on to Secretary Pete Hegseth and his new order that all troops over age 30 get tested for their testosterone levels. Here's more of Hegseth on that.
While we invest heavily in our weapon systems, platforms, and gear, our most decisive tactical advantage will always be the individual warfighter. We have a sacred duty to maintain that advantage, which is why we must constantly look for new ways to optimize your performance, your resilience, and your long-term health.
So tell us, Dr. Faust, as a physician, is there a relationship known to medical science between testosterone levels and one's job performance as a warfighter?
Not that I'm aware of. But I would just say that this is not the first time this year that the Secretary has delved into health. He removed an influenza vaccine standard that meant people who were enrolling in the U.S. military needed to have an influenza vaccine up to date. And not long after, we had a flu outbreak on a base in June. So this is ill-advised. They have, of course, reinstated that policy. And now he comes out with this idea. And it's very coded in the sort of toxic manosphere thing of we got to have more testosterone. And I don't see a connection. But also, I'm not a urologist. I'm an emergency physician. So what I actually tend to see is what a lot of people don't see, which is when bad things happen, which is when there are side effects. So if there are side effects to medications or any treatment, trust me, I see them because they come to the ER for help. And we know that when you prescribe any treatment, there are risks and there are benefits. And in this case, we can talk about why this is the case, but there are really no benefits that we can expect from this policy. But there are risks because taking what we call exogenous testosterone, meaning taking it from the outside, a gel or other forms, has side effects. And some of those include increases in dangerous blood clots in the lungs, broken bones, and in high-risk populations, there have been associations. It's not causal, but there have been associations with major depressive disorder and suicidality. So I really worry as more of a public health and epidemiology hat. I worry more about this in terms of the grand scale effect rather than the individual.
Listener writes, I take testosterone because I'm a trans man. I don't think Secretary Hegseth has a good grasp of endocrinology. There's a broad range of testosterone levels considered normal and healthy in men. It's also normal for these levels to fluctuate. That came from a trans man. I saw where some people have mocked this as Pete Hegseth's version of gender-affirming care. Do you think that satirical label applies?
I actually did sneak that talking point in on CNN last week because I think there's something to it. And the the person who you just read their comment, they're correct. There's a wide range of testosterone levels that are normal, and some people have low levels but do not have symptoms. And for those people, that would be called asymptomatic low testosterone. There's no evidence that testosterone will help them because you can't make someone better than asymptomatic. Now, there are other reasons to give testosterone, including for gender-affirming care and including for people who have low testosterone, and symptoms that go with that. In that case, then the risks that we talked about become part of a balance between the risks and the benefits. And so that's, I think, an important distinction, that medications that work for people with symptoms don't necessarily mean that we should give them to people who are asymptomatic, because actually what happens in those situations is risk.
Listener asks an obvious question in a text. Are they going to test women also?
I believe they are. And this is all also above the age of 30. And again, I don't know what this hopes to achieve. There's a question of energy levels or focus. But again, those things aren't probably the reason behind those issues. We have obesity. We have other things that can cause people to have all kinds of metabolic effects. I tend to just think that this was not thought through all that carefully.
You know, I had a thought, and tell me if this is unfair, that in an institution, the U.S. military, with a record of a lot of sexual assault, more testosterone may not be exactly what's needed. Or is that an unfair thought about what the hormone might produce?
That's a very reasonable thought to have. I can't tell you that I've looked around the literature on sexual assault and testosterone supplementation, so I'm not going to get ahead of not having done that PubMed research that I would do if I knew that question was coming. But I would say that it's the grander point, though, is that when you do something like this, especially at scale, you are really inviting the unknown to bite you. Because we don't necessarily know from a study of 10,000 people what might happen when 1 million people take it. And so the United States government is going to own those effects. And so we didn't know, for example, when you gave millions of people Vioxx, which was a painkiller that was no longer on the market, that it would cause some heart problems in a very small number of people. Some people say that the companies knew, but I think you could argue that even if they did, but they weren't sure, until so many people took it, that this signal emerged. And so, okay, then you have to say, is it worth it? And it was determined not. And so here you could really get in a situation where some signal of harm would actually emerge in exchange for nothing.
And we should say, just to be clear, that what he's mandating is the tests, not that anybody who tests low would be required to stay, in order to stay a U.S. service member, to take a supplement, right? That what he's mandating is the tests. But I guess presumably that would lead to a lot more people taking it in the armed forces than take it today. Dale and Chelsea, you're on WNYC. Hello.
Oh, hi there. So I would urge everybody to go. Are you still there?
Yeah.
Okay. To go to This American Life and look up contesterone. The staff, and of course it's amusing because it's This American Life, the staff, everybody took a testosterone test, and the male with the highest testosterone was David Rakoff, who was a gay man, rest in peace. And then there was one of the women in the staff who had high testosterone. It doesn't mean anything. It's ridiculous.
Dale, thank you very much. Well, meanwhile, Dr. Faust, voluntary testosterone is popular in the culture now, too, right? For example, an article in May in the medical journal Nature, because I read into it a little this morning, was called Testosterone Therapy is Trending, Who Really Needs It and Why? And it says some clinicians are pushing to broaden testosterone use, but there is debate about its benefits and risks. Do you have a take on why it's trending as a supplement? You started to mention before its risks and benefits, but why do you think it's trending as a supplement?
Well, there's this idea, there are a few ideas out there that for example, is the sperm counts on the population level lower? What do we do about that? Fertility rates, that kind of a thing. And there's just some degree of masculinity culture that I think has seen a resurgence. Anytime, though, and I'll just reinforce this, anytime we add a medication to a large population, you're about to find out. And we've seen this before. And I'll just say this, and this can work out in different ways, by the way. Two examples, actually, that are sort of related is estrogen as a birth control works phenomenally well. But early on in that experience, the doses were too high and the risks were too great. And so the scientists had to go back and change the dose to make this risk-benefit calculation work. And on the other one is a hormone replacement therapy, which really got dogged this whole century based on some concerning research, but research which many people, and I tend to be sympathetic with this, many people think was overinterpreted and accentuated these low, important but low rates of possible harm, but ignored these tremendous possible benefits. And so my point is that these are actually very complicated questions that require study more than just like a post by the Secretary of Defense.
And you mentioned estrogen. I mean, one of the other things that I, as a layperson, just wondered as just a thought bubble, maybe all troops should be tested for their testosterone and their estrogen levels, since I've read that excessively high or low readings of either can be detrimental to either men or women.
I would not support that. I would support what we say. Let's do the minimum that we need to the minimum that we need to do. One of my great mentors says you always want to do as little, make things as keep them as simple as possible, but as complex as necessary. And this to me seems like we're going to get in a fishing expedition.
So last thing, I've also read a critique or suspicion that this is mostly another vehicle for getting women out of combat roles, which Hegseth has publicly supported, before he became secretary, without him having to order it that way per se. Could this program have that effect?
I'll leave that to a military strategist. I don't know. What I do know is that it's important that we have a armed forces that's healthy and that has health care. I wish everyone in the United States had the health care that our military service people have and that our veterans have. We have a wonderful medical and healthcare system for these people who serve, but not everyone has that. Some people join the military to get healthcare. That's the bigger question: is why do we not have access to these kinds of resources across this country?
Dr. Jeremy Faust, emergency medicine physician, public health researcher, and author of the Substack newsletter, Inside Medicine. Thanks so much for joining us.
Thank you.
WNYC's journalism and storytelling is heard by millions of passionate listeners. Sponsors of our programming gain our listeners' attention and their respect. Learn about how your organization can support WNYC and WNYC Studios at sponsorship.wnyc.org.